Hi, I'm Emily.
I'm Kirsten.
I'm Ashlyn.
And we're going to talk about coping.
All right, we're going to talk about what is coping. Coping usually involves adjusting to or tolerating negative events or realities while you try to keep your positive self-image and emotional equilibrium. Experts have said that coping is a process rather than an event. It's something that'll change as we change, and we may have to try different coping strategies in order to be successful. But also, coping isn't just negative situations, it's also positive situations and any changes that we find in our lives that we'll have to adjust to.
Alright, so I'm going to talk about how coping applies to nursing. And it applies to nursing because it's a way to manage stress. If a nurse becomes stressed, they're less likely to perform their job the best that they can. Finding different coping mechanisms is good because it can help reduce stress. Stress isn't the only factor that can affect a nurse, though. Exhaustion is a way that a nurse could be affected. If you ever thought about a time that you were extremely exhausted, think about how difficult it was to take care of yourself, let alone another person. It applies because it's a way to help take care of you and the patients that you are taking care of.
Cool.
Okay.
I spoke with some real-life nurses about their experiences with coping in the nurse work world. One such nurse shared her experience with me and said, "I've realized that in striving to be the best nurse I can and exhausting all my efforts that sometimes others will still not view them in good light. Patients and their families are in a stressful, generally unhappy circumstance when they are in the hospital. Doctors and other staff members can talk down to you. It is common to feel overwhelmed with the workload. Some of the greatest things that have helped me were to first build a rapport with other staff members, to be positive and kind, and to help when it's not my job or when it's unexpected. As an RN, helping ambulate, bath, or change bedding makes an impact. To answer call lights and offer help, give pain medication, or call a doctor for another nurse who is not able to do everything right, then builds connection. It's amazing what others are willing to do when you have sacrificed to help them." So it's so important that we nurses understand the things that are going to help us in the job force so that we can best help our patients and know that it's okay to make sure we're okay.
Hi, I'm Miley.
I'm Hannah.
I'm Kiara, and we're going to talk about compassion fatigue. I'm going to be talking about what is compassion fatigue. Compassion fatigue is the unfortunate side effect of working with people who have been through trauma. The person that is suffering from compassion fatigue develops secondary traumatic stress and burnout. They take on their patients' problems and they invest so much and empathize so much that they start to grow numb to their patient's suffering. They develop extreme mental and physical exhaustion that makes them unable to cope with their work environment. The symptoms of compassion fatigue are exhaustion, irritability, and anger, a decrease in the amount of feeling of sympathy and empathy, and the loss of enjoyment or satisfaction with work. It can also lead to anxiety and depression, post-traumatic stress disorder, and other unfortunate coping mechanisms like going to drugs and alcohol.
Okay, I'm going to be talking about how this affects nurses in their work. There's three kind of general categories that affects their work, their emotions, and the physical things that they do throughout their work, such as being depressed, avoiding patients, or not wanting to interact with them, having issues from stress like stomach issues or anxiety, depression. Sometimes they're more irritable, they have more mood swings, things like that.
Alright, I'm going to talk about a real-life example of compassion fatigue. With the COVID-19 pandemic going around right now and placing even more strain on healthcare workers, compassion fatigue has had growing awareness. A hospital in Memphis even created a compassion fatigue break room for staff who needed to take a break when struggling with compassion fatigue. The room had a massage chair and other comforts, and higher-ups would encourage their employees to go when they noticed them struggling with disconnect and other issues. Therapy has also been encouraged for staff at that hospital and others to help cope with compassion fatigue. Hopefully, as awareness grows even more hospitals can have rooms like this and support their nurses through this hard issue.